Now let's look at where we stand in India today. Prevalence of spinal cord injury and the access to rehabilitation in India is dismal. We have 20,000 to 40,000 cases happening every year. With a life expectancy of about 40 years, we have about 1.5 million spinal cord injured patients living in India. We have a huge burden of spinal cord injured patients, and the urological needs to be met with, which is unfortunately remain unfulfilled. Variety of causes lead to spinal cord injury. Falls remain the predominant cause in Indian scenario, although with road traffic accidents catching up with the high vehicular speed traffics. Most of the patients are younger and men. They are the primary earners, and the goal of rehabilitation is to make them earners rather than burners. The prevalence is distributed equally between the rural and the urban areas, and one can understand the plight of rural areas in the lack of amenities, urological access, and other medical facilities. There are grossly deficient rehab services. We have 1 to 2% of patients who actually get access to proper rehabilitation in India. This has been cited in various state reports and WHO reports. Compare this to 4 major rehabilitation centers in a smaller country as Switzerland, 12 centers in UK, and 1,170 rehab centers in USA. And in India, we just have 3 quality rehab centers. CMC in Vellore, Indian Spinal Injury Center in Delhi is the largest, followed by St. John's in Bangalore. There are a number of other 28 rehabilitation centers. They're small, they may have 20 to 40 beds per rehab center, but most of them may not have a comprehensive care, and many of them lack a dedicated urological facility. There are less than 1,000 SCI rehab beds across India. Majority of them are in these 3 primary rehab centers. ISIC is the largest comprehensive care center, offering about 200 beds, and also offers a dedicated neurourology service for urological, sexual, and fertility care needs of its spinal cord injured patients. You can imagine that Europe has 2 such institutes per million population. Compare that, India would need to have 2,000 centers to match up to the level of Europe, and we just have 3 at the moment. Dr. Ketna Mehta also took up a study where she wanted to study the potential for making a world-class rehab center in Mumbai. This is the relevance of and the need of rehab centers in India. Neglected neurogenic bladder, by definition, is something where a person does not even have one visit to a urologist in the comprehensive evaluation. Optimum visit, however, will include sexuality, fertility, urodynamics, and other advanced forms of evaluation. These are some of the guidelines whereby renal function imaging, urodynamics, cystoscopy are advised at 6 to 12 months period interval. Neglected bladder would lead to a number of complications as stricture, urethral diverticulum, bladder stones, sphincteric spasm, or in the presence of a long-standing catheter, torn urethra. It would not only affect the bladder, but would also lead to changes which would ascend up to the upper tracts. The urethra and the ureter will also be affected. So this leads to structural and functional deterioration of the whole urinary tract. Vesico-ureteric reflux causes dilatation of the pelvic ileal system and impairment of the renal function, and patients end up having recurrent pyelonephritis and loss of kidney function, leading to kidney failure. Bladder stones are very common in patients with indwelling catheters, and these stones are a cause of morbidity and recurrent infections. Long-standing catheters, because of the friction, often produce tumors in the urinary tract, and a number of them could turn out to be more aggressive squamous cell carcinomas. In developed world, urological conditions have been taken care of and are no longer the cause of death. However, in India and low middle income countries, these preventable complications still are a cause of death in more than 15% of patients. Prevalence of neurogenic bladder is extremely high. 80 to 95% of spinal cord injury would have neurogenic bladder. Bladder is an unreliable witness. Best is to test it. Don't depend upon the symptoms. And besides physical changes, it also leads to psychological depression, impaired quality of life. It also has a significant impact on the social and financial functions of the patient and their families. Accessibility of neurourological care in chronic outpatient setting is extremely poor. Compared this to the Western world, they have to overcome. We still have 15% of our deaths because of urinary complications in India. We did a survey of about 4,800 patients over 5 years and found that 80% of our patients suffer from neglected neurogenic bladder, having never seen a urologist, and for majority of our patients, ISIC, when they came to us, was the first stop. Most of them continued to be treated for their bladder problems by their neurologists, spine surgeons, orthopedics, neurosurgeons, general physicians, and just about everyone. Most of the spine units in India don't offer dedicated neurourology services. Urological care in India is random, variable, and non-standardized. Even when these patients meet with general urologists, they are hardly properly evaluated and educated. 95% of patients never had a urodynamics before coming to us. Most of the patients continue to remain on indwelling catheter and condom drainage. CIC acceptance is low, proper guidance and discussion is not there, distance support is not provided. A number of patients continue to reuse their catheters. CIC was being done by some patients, but majority were doing it improperly and untimely, once or twice a day. Most of them were told to do CIC but were never properly trained, so there is a high dropout rate. Lack of appropriate pharmacotherapy to control the bladder pressures and to prevent the upper tract damage is extremely rampant. Less than 20% were taking. There is lack of affordable medicines and lack of availability. 99% of our patients never had any discussions on sexuality and fertility by any professional, no matter whatsoever. There was no counseling, education, or guidance, and these patients remained in their cocoon, feeling shy whom to talk to. And when we talked to them, they felt great satisfaction. They enthusiastically participated and felt free from anxiety and very rejuvenated in their rehabilitation program. Such is the impact of their sexuality discussions. Yearly follow-up as advised, which is very common in the developed world, is seen rarely. Less than 5 to 10% of patients would yearly follow up for a comprehensive urological care. Urinary complications like infections, incontinence, stone formation, and stricture urethra, renal dysfunction, and renal failure have a high incidence in India, which is extremely disturbing and shocking. Antibiotic therapy is excessive yet inappropriate in majority of cases where patients are seen merely on bacteriuria and pyuria unnecessarily and far too aggressively. There is a lack of experienced urological supervision, and there is a lack of awareness amongst the general physicians about how to manage the spinal cord injury and their infections. We have to treat the patient and not just the urine report showing pyuria. Autonomic dysreflexia, a very serious complication occurring in patients with T6 and above injuries. 85% were never educated, no ID cards are provided. Australia in comparison had a beautiful system of education and providing AD cards, which comes handy. Urological complications continue to be a significant cause of death in India still, and this is something which is very disturbing and something that we need to work upon. And this risk increases with the level of injury. 99% of patients will have serious issues of some or the other form of neuropathic bladder involvement. Compare this to multiple sclerosis, about 40%, and spina bifida, about 90%. Bladder management protocols are well established in developed countries. However, very little is known because there is no healthcare system, there is no documentation, there are no protocols, and there are no facilities which monitor the spinal cord injury. Since we have this tsunami of neglected bladder care devouring our spinal cord injured patients and affecting their health and their lives, can we undo the damage? Thank you so much for your very kind and patient listening.